fracture both bone leg. This is a fracture both bone leg in a 7-year-old child. High velocity injury. You can see the combination. There are abrasions here around the ankle. That's a telltale sign of injury, high speed injury. Besides small other injuries, so therefore, though it can be treated with plaster, with initial plaster, keeping the slab after it heals, then we can put a or bivalve cast, then we can put a long leg plaster followed by below knee plaster with which he can walk. But for comfort and to avoid displacement and for the better dressing, after counseling, parents wants operation. Patient agreed for other operation. There is informed shared decision, informed consent and shared decision, not only informed consent, shared decision to fix it with the most modern titanium elastic nail. So under C-arm control, we are making two entry point and avoiding the growth plate here. You can see we select the appropriate nails. Appropriate nails, titanium elastic nail, which are elastic nail so that it fills up around 80% of the medullary cavity. Then the fracture here, so we'll bend it, pre-bend it so that it can be widest diameter adjusted here for 3-point fixation by two nails, one from this side carved nail, other from this side carved nail, so that 3 points here like this, the medial nail and the lateral nail will be like this from this to this leg, so that at the maximum decussation or spreading of the nails is at the fracture site, thereby giving the stability. So after the selection of the nails, we'll pre-bending it like this, okay, and then we'll do the operation sequentially. Under C-arm guidance, we will hammer the nail, and whenever stuck, we will rotate a bit with the T handle, thereby the nail is not engaged anywhere. So now, this is the fracture. You can see this is the we have tried to identify the entry point. Next, we have selected the point laterally. Next, so selected the medial point. Now, next, we're introducing the nails. Yes. Next, where you can see the nail entering into the medullary cavity. Next, the other can also put like this. Next, you can see it's almost at the posterior border. So next we will rotate the nail. You can see it's not hitting. So I'll try to rotate it. Next, you can see next. Now I have rotated the nail tip so that you can see there is clearance of the clear space in between the nail. Now we are rotating the other nail also. Now I am pushing that further. Now I will de-rotate it. Next, gradual hammering with slam rotation this way and that way so that nail ends does not get stuck. Next, both the nails progress sequentially. You can see the fracture reduced 12. Next. So now you can see with the metaphyseal region where I am putting the nail. You go back, please. Previous agita. Go back. So you can see the gap here at the fracture side. Now next. Now it's increased. So because it's metaphyseal bone, which is not like a medullary canal of that hollow, so cancellous bone, that's why nail giving resistance, thereby destruction. We should be careful about it. Next, So I am withdrawing the nail. Next. Now you can see after withdrawal of the nail and hammering that down slightly over the thumping over the heel, you can see the space reduced. So good position. You can see the spread filling the cavity. Though comminution is there, it's stable now. Next. Fibula need not be fixed here. The lateral view. You can see some opening of the lateral view. So you can see this is the lateral view. But yes, now with some pressure, so the nailing is completed. So tightening it now, we will close the wound. However, for the other thing, if you see with some posterior pressure, posterior angulation, slight bowing was there. Go back earlier. You can see some bowing, that's acceptable, remodels very well, but with now you can see the next forward. Yes, you can see the angulation is corrected because the space here is anteroposterior much more. So though it's elastic, it has its own memory, so that bit is not a problem. However, putting a simple slab will be better. Next, we will close the wound so that we can okay. Needed, you can see logo whole of the leg, otherwise not untouched.